had an injury of the anterior cruciate ligament, which is the ligament in front, and the medial collateral ligament, the ligament on the inside, as well as the lateral meniscus, which is on the outer side of the knee. Now the anterior cruciate ligament connects the bone on top with the bone at the bottom in the knee and prevents the knee from going front to back. The medial collateral ligament prevents the knee from opening up medially like this. So in her, what I've basically done is reconstructed the anterior cruciate ligament, repaired her lateral meniscus back in place rather than removing it, as well as supported the medial collateral ligament by doing a cosmetic procedure in which I have put a band or a very strong tape along the origin and insertion of the medial collateral ligament so that it heals over it through small little incisions that are cosmetic for the patient rather than completely reconstructing the medial collateral ligament. So at the end of it, this patient was stable in the front to back plane and the mediolateral plane, as well as she had a repaired meniscus that healed up very well, and she did excellent after 6 months.